Experience holiday cheer at Tanger Outlets with savings up to 70% off your favorite brands. From fragrances to accessories and the latest styles, discover the best gifts for everyone on your list. Save big at Nike Factory Store, Michael Kors, Under Armour, Coach, Polo Ralph Lauren, Kate Spade New York, and so many more. Unwrap the best at Tanger Outlets. Hundreds of brands, endless gifting options. Plan your trip at Tanger.com.
But now that it's Thursday, out of the 8:30 news, it's time for another segment of What's Up, Doc, where we spend some time with the experts at Mercy Health. We learn all sorts of things, and as we pointed out, they learn, don't get talked into doing radio interviews.
It's like, oh, yeah, that's why we're doctors.
That's right.
Yeah.
We don't want to have to do that.
Yeah.
We drew the short straw. So anyway, we're going to learn a little bit about sleep and things regarding sleep, and we're going to learn that from Dr. Mohsen Khan with Mercy Health. Dr. Khan, good morning to you.
Hey there. Good morning, guys.
How are you this morning?
I'm doing excellent. How are you?
We have nothing to complain about. Tell us a little bit about you.
Sure. We did this interview. It was, I think, just less than a year ago. It was a lot of fun. We covered quite a bit. So I really enjoyed that. So I grew up, a nutshell version, I grew up in LaSalle County, so just south of here, out in the country. And my father was a family medicine practitioner, so kind of grew up in the whole agricultural family medicine background. Midway through high school, we actually moved back to our home country, which is Pakistan. So I lived there through high school, medical school, came back to Rockford and did a year of research at the College of Medicine. Fast forward, I trained in neurology at the University of Chicago and then completed my sleep medicine fellowship at the University of Chicago. Lived in Nebraska for 3 years and then came back to Rockford where I have a beautiful family, a farm, and no complaints. I'm having a good time.
Outstanding. That's a great tale.
So 3 years in Nebraska, you said that's enough. I need to get back to Illinois.
I'm tired of looking at corn.
Nebraska is a beautiful place, honestly. People are great. It's one of the happiest states in the country. But family's closer to here, and I wanted a place that was, closer to. We kind of talked about this. So my wife is from close to New York City, and I wanted to have a farm, and so I needed a place where we could kind of do best of both worlds, and this worked out for us.
Yeah, you can't get a lot of good acreage in New York City, from what I hear.
That's true.
Yeah,
it would be expensive.
I do remember talking to you last time and talking about your farm. Didn't you have chickens or something on your farm?
Well, we actually raised Nigerian dwarfs, which is a miniature. Yeah, they're mini goats, actually.
That's right. You're making those small goats. That's cool out there.
Oh yeah, I've seen those on goat yoga videos. Okay. I know the ones we're talking about.
Absolutely, you should come out sometime.
We would love to, Dr. Khan. You're with the right guys here to talk about sleep and good night's sleep. Because we get up at 3:00 in the morning. And we have found that we can actually probably get sleep if someone would just stop talking to us for 5 minutes once the show's over. Pretty easy.
Yeah, you probably have to go home and maybe take a short nap too.
Yeah, there is that the beautiful days that do allow for laying down a little bit, so you're not falling asleep during Wheel of Fortune at 6:30. Yeah, that is definitely helpful. Tell us a little bit about the whole process of sleep medicine, because were we talking sleep medicine 30 years ago?
Right. So sleep medicine is it's a relatively new field. I mean, in the 1950s is really when we discovered sort of the foundations of sleep medicine. When we talk about sleep medicine, we're talking about sleep disorder breathing, which is obviously obstructive sleep apnea, which is the main thing that comes to mind, but also restless leg syndrome, which is kind of creepy crawlies, restlessness in your legs. Seizures at night, so seizure disorders that are nocturnal, as well as sleepwalking and sleep talking. So we do both pediatric as well as adult sleep medicine.
One question, you mentioned the restless leg syndrome, and I'm just wondering if this is something I've experienced before, but I only experience when I take a sleep aid, some sort of Excedrin PM or something like that, and I do feel weirdness in my legs. Is that possible? Am I feeling that? Can sleep aids bring some of these disorders on?
Yes, actually, this is very interesting that you mentioned that, because so a lot of the over-the-counter sleep aids have essentially Benadryl, so antihistamines. Antihistamines actually trigger restless legs. So there actually are a number of medications that will trigger restlessness in the legs. and the lifetime prevalence is like close to 90%. So most people experience some type of restless leg syndrome during their lifetime, and it's completely curable and treatable. So it's very satisfying to manage those patients, because with a couple tweaks, we're able to get them comfortable and resting well at night.
That's really cool.
And how about what I just said? Did you shudder at all when I said I'm taking Excedrin PM or something to go to sleep? How do you?
I bet he's making a note on the legal pad right now.
How do you feel, and the profession itself feels about the over-the-counter sleep aids?
So, I mean, there's the official stance, which is that it's discouraged. However, the practical stance, which is that if it works and it's not causing any problems per se, then I'm okay with it. The main issue with treatment of insomnia is really treating the underlying cause. So a lot of times insomnia, trouble falling asleep, staying asleep, is related to underlying stressors such as anxiety or just volume overload, just taking on too much stress. And there are other medical conditions, medications, et cetera. So we have to look at kind of the whole picture.
Remember my mom saying, the reason that you can't sleep and all that is because you've done something bad. That was, she used that one on me quite a bit. Oh, yeah, I couldn't sleep last night, a little insomnia. Well, maybe you have something you need to confess, and I'm 8. There really wasn't. After conferring with my attorney, it turned out there was nothing. Nothing.
She was just explaining anxiety to you at that point.
I think that's maybe exactly what she was doing. So along this topic, Dr. Kahn, how much, because, the sleep industry, the sleep aid industry, the pillow, the mattress, the special weighted blanket industry, they're raking in billions of dollars pushing claims that, hey, the only reason you're not getting a good night's sleep is because you're not sleeping on a purple mattress, and you don't have a weighted blanket, and you don't have these Egyptian cotton sheets.
And a square pillow.
Yeah, and a melatonin supplement sitting on your nightstand.
Well, I mean, you don't have to spend a lot of money to get comfortable, and there is some credence to just the kind of the comfort, definitely the comfort of the mattress and different types of pillows. And so we really have to customize based on, for example, patients who have a lot of neck and shoulder pain, they actually sleep much better with an adjustable base. And so if you have a lot of neck and shoulder pain, you'll do better with certain types of mattresses, especially the ones that have a base that allow you to raise the head of the bed up just a bit. So, I think there's definitely something to the sort of the supplements as well as the setup of your bed and all of that, but you don't necessarily need to spend a lot of money. I was hoping to actually talk a little bit about a couple of new therapies for sleep that are up and coming, people are hearing about and asking a lot of questions.
One of those would be the Inspire device, right?
Yes. So, getting a lot of questions about Inspire, and it's kind of a cool and new and a new therapy for obstructive sleep apnea. So, of course, most people are familiar with sleep apnea. Snoring itself is not a problem, but if we snore to the point where we have low oxygen or it's disrupting our sleep, then that starts to put a stress on the heart and raises your cardiac risk. So that, I think, is pretty well known and well understood. The challenge is that one of the challenges that the gold standard therapy is CPAP, and CPAP nationally has about a 55 to 65% adherence rate. So about a 65% roughly success rate. Our internal numbers show about 85%. And we do, I think, a pretty good job just because we do a lot of face-to-face troubleshooting. And so whatever it is about the mask or the tubing or the leakage that needs to be adjusted, we try to get that adjusted right away. But the question comes into play as far as patients that just don't get adjusted to CPAP and sort of what other options do we have available. And so that's where the Inspire device comes in. So for patients who are moderate to severe in their sleep apnea and are not significantly obese, and so patients who are not significantly overweight, so BMI of 35, which is a weight adjusted for height, they would be a potential good candidate for the Inspire device. So what this is a pacemaker for the airway, and essentially you have a small pacemaker that is connected to the hypoglossal nerve, so it's a nerve stimulation therapy. We've been doing nerve stimulation for decades with different targets. Vagal nerve for epilepsy, deep brain stimulation for Parkinson's and tremor. And so we have a lot of experience with the technology. And what the Inspire device does is it actually stimulates the airway during inspiration, and hence the name Inspire device. And so essentially what's happening here is we're snoring to the point where on inspiration your airway will collapse. And what the Inspire device does is it gives a micro stimulus to the airway to hold the airway open during inspiration. So it has an 85% efficacy in terms of reducing apneas, which puts us in that range where it has a cardiovascular benefit, and also the multiple studies that have come out now are demonstrating symptomatic benefits. So people feel better and they're healthier. So it's a great option for patients who have tried and failed CPAP and meet the criteria as far as their body mass index. And the process essentially is they would see their sleep provider, and then it's a multidisciplinary setting. So we have a surgical team here at Mercy Health in the ear, nose, and throat department, Dr. Z, who's a phenomenal surgeon, and they would evaluate the airway to determine its collapsibility and whether the individual would be a good candidate for the procedure. And if testing shows that they would have positive results, we would proceed with the procedure. It's an outpatient procedure, so you're in and out in one day, and then essentially we go through a process of programming the device to optimize the therapy.
This is a fascinating,
fascinating
device, and I love the way that we kind of use some technology that we've used for other conditions into this. But it also sounds like it's active all the time. Is this something that people will notice when they're not sleeping? If something happens, will they feel a spark in their throat?
That's a very common question, and so no, it's not active throughout the day. So there's a remote that turns the device on, so the patient will actually turn it on at night, and we program it such that we will sort of titrate or adjust so that there's no discomfort as far as any pain or abnormal sensations. So it's a very low dose of current, so it is an electrical stimulation device, and the hypoglossal nerve is responsible for the muscles of the airway, and so it's gently activating those muscles during inspiration and holding the airway open. And in the morning, you turn it off.
That success rate that you're talking about, though, that's pretty amazing.
It is actually.
And then just one last one before we get you out of here. How prevalent is this? Is this can we go to any major-ish city around the country and get this done, or is this are we kind of cutting edge here in Rockford?
I would say we're cutting. I would say we're cutting edge. I mean, there are very few centers. That's been the challenge over the years. Is just the travel to There's a couple sites in Chicago that are doing it, and so finding availability of a sleep center and a surgeon, and also with travel and everything, it's definitely been a barrier. So we're very excited to offer the procedure locally, because I think it'll be high impact on this particular population.
All right, you guys remember the name, the Inspire device. When you make that call to find out more, that's what you're going to be asking about. Dr. Kahn, we enjoyed you immensely when you were here with us the first time. No difference the second time. You've educated us once again. We appreciate you taking time for us.
Absolutely, I appreciate it.
Dr. Mohsen Khan with Mercy Health.